So I'd like to welcome Dr. John McDougall to Fever FM. Dr. McDougall is a graduate of Michigan State University's College of Human Medicine, performed internship at Queen's Medical Center in Honolulu, Hawaii, and in 1972 had his medical residency at the University of Hawaii. Also a member of the advisory board of the Physicians Committee for Responsible Medicine. He was also one of the 4 named plaintiffs in 2016 who issued a lawsuit by the PCRM alleging improper influence by the egg industry on establishing cholesterol recommendations in the United States. John McDougall, MD, is the author of 13 national bestsellers, including one of the top-selling books recently on Amazon, The Starch Solution, and a clinical instructor for 4 medical schools in the United States. Dr. McDougall is a recipient of the Lifetime Achievement Award from the American College of Lifestyle Medicine. Dr. John, along with his wife, Mary McDougall, are co-founders of Dr. McDougall's Right Foods, which offers convenient food products such as soups, ramen, and more. The McDougall Program has helped thousands of people to get off unnecessary medications, reverse and heal serious health problems such as diabetes and high blood pressure, reducing their risk for cancer, arthritis, and heart disease. Learn why they're sick and how to get well. This program has been healing people from all over the world for over 35 years. It's worthwhile saying the McDougall Program centers on a diet of 90% starchy plant foods, such as potatoes, beans, corn, rice, and includes whole grains and whole grain products, such as pasta, tortillas, and whole grain bread, and 10% of a wide assortment of vegetables and fruits. And we've got Dr. John McDougall in today to talk to us really about diabetes, coronary artery disease, chronic kidney disease, as well as glaucoma. And maybe we'll be having the chance to touch liver and mouth cancer in today's interview. Dr. John McDougall, thank you very much for joining me today and making time for the listeners of Fever FM.
Well, thank you. Thank you. I think there are a couple of other things I'd like to mention as far as my bio goes.
Please go ahead.
I'm a board-certified internist, which means I'm a specialist in adult medicine. I've been in practice for more than half a century. And personally, I've taken care of over 12,000 people, and which, makes me somewhat unique in the sense that I'm a real doctor practicing real medicine, taking care of people like you. And so it gives me a perspective a lot different than many other people. In other words, my focus of attention is on the patient. So I got a lot of the information that I have today. I gained from what happened in Western Europe during World War II. It was quite an education for people interested in a good diet. During World War II, you had the German occupation of Western Europe and blockades that prevented, that caused food shortages in all of Western Europe, but also in England.
Rationing.
And what happened is, when people couldn't afford to eat the meat and the butter and the cheese and had to eat more grains and potatoes, etc., is their incidence of heart disease almost vanished. And so did with diabetes. People stopped having diabetes. They stopped having new attacks of multiple sclerosis, and people with multiple sclerosis, stopped having repeat attacks. Everything about the European got much better as far as their health is concerned. And they also saw a blip like this occur during World War I, and it was associated with a reduction in intake of rich foods. It's rich foods that make people sick. And that, one of the basic premises that if you get anything out of this talk we're having right now is to understand that people are ill because of the food. We're eating a diet in Western Europe and now in Asia, and of course, in the United States for decades, eating a diet that was once reserved for kings and queens, pharaohs and priests. And I mean, the rich people in every society could afford to feed animals the basic starches, and then they'd eat the animals. They'd eat the birds and the cows and the pigs and the sheep and so on. And that's a luxury only afforded to the royalty. Whereas the common person, the person building the pyramids or tending the fields, they had the advantage, and they probably didn't understand it then, and most don't now. They had the advantage of eating the diet intended for people. The diet intended for people is based upon, oh my goodness, it's based upon 100 billion people that walk this earth. It's based upon all of history. When we look back at archaeological findings and so on, what we find is that the human being has, and until just recently, lived on a diet based on starches. And let me give you a few examples. In the United States, we had the Native American. And the Native American, we can document 10,000 years ago, lived on potatoes. And 12,000 years ago, lived on corn. And so it was in the populations of Central America. The Aztecs and the Mayans were known as the people of the corn. That was their, 90% of their food came from corn. If you look a little further south at Central America, then you're looking at populations of people who lived in the Andes, where the primary source of energy was starch in the form of potatoes. And that's still a dominant part of the food in South America. If you look at Europe, there's an area of your continent that is described as the bread basket of the world. It's not the pork chop basket of the world. It's the bread basket of the world. And if you think about Asian countries, and most people can go back 50 years, but you can go back 5,000 or 10,000 years, and you can see that the intake in Asian populations was primarily rice. That's what they're known for. They've switched among various starches. But wherever you look around the world throughout history, what you find is that people lived on starches. 90% of their diet was starch. And then they included some fruits and vegetables that were in season. And occasionally they were hunters and fishermen, and they'd go out and catch themselves an animal. But this was something that didn't happen very often, wasn't as reliable as the crops. And if they did catch something, it spoiled quite quickly. There was great difficulty in preserving these foods. So, that's what the history of the human being is. Although you hear a different history, what you hear is that people have been hunter-gatherers, with the emphasis on hunting, that is somehow the most important part of our food intake. This is sex bias. This is gender bias. This is what's been going on with people forever. And that is that men get all the glory. Okay, men were the hunters. They went out and hunted. Maybe they caught an animal after a couple of weeks, and maybe they got the animal back to the village in time for other members of the village to eat parts of it. But who was obtaining the bulk of the calories for these populations? They were the grandparents and the women and the children. And you know how human history is. It's sexual bias. It's gender bias. And so that's why we have the reputation that we were primarily hunters in the term of hunter-gathering, but that's not true. Archaeology science does not support that. Anyway, what I tried to explain to you is why people are sick in Western Europe, the United States, and now becoming very ill in Asia and India. Is because they're eating a diet of kings and queens, which has always made the royalty overweight, gout in their feet, etc. And the way to get things right is to go back to the diet of human beings, the human being based upon science, based upon history, based upon geography, based upon religious writings. The human being is a starch eater, a starchivore, a starchitarian. 90% of our food intake has always been, in successful populations, large populations, it's always been starch. There have been extremes to the environment where people have not lived on starches, like the Inuit Eskimo. Their environment did not allow people to live on starch. They had to live from the foods that were available, which were primarily mammals and fish. But otherwise, except for the royalty and a few isolated populations, you find 99.99% of people who ever walked this earth have been starch eaters. And the reason people are sick in mass as epidemics. I even read an article this morning in the newspaper that teenagers are getting bariatric surgery for weight loss. This is a tragedy that should never have happened, except for the fact that it supports the financial interest in the food industry and the medical businesses. And of course, that's the driving force. It's money, as always. Anyway, there's a brief understanding of what the problem is and what the solution is.
Okay.
And I've been in the practice of what I call diet therapy for 46 years. And as I mentioned, I've taken care of over 12,000 people. I've published scientific articles on our work, and our cure rate is tremendous. Why? Because we fix the problem.
Great. I mean, that's excellent. I mean, and also as a kind of a preface to the questions that we're going to come into on heart disease, diabetes, chronic kidney disease. A lot of that, just in researching it, it mentions in all cases that not just Afro-Caribbean people, but in particular South Asians suffer with much worse outcomes, suffer in much higher rates of incidence of all of these diseases. And the assertion seems to be that there's a genetic basis to that. But just from what you've said there, reflecting upon the learnings from the Second World War and rationing, where chronic heart disease, stroke rates, etc., declined dramatically because certain foods weren't available, or that you were reflecting upon times long gone when it was the pharaohs and the kings that were getting these diseases because they were the only ones who had access to such rich foods. So I'm interested in your point of view that these illnesses aren't of a genetic predisposition, which a lot of our listeners will feel like it is, but rather it has another basis which needs to be given proper consideration for. And your assertion here seems to be that it's the food.
Well, even if it was genetic, what are you going to do about it?
Right.
I mean, you can't change your genes. And there is some genetic predisposition, and that it probably reflects natural selection. In other words, in European populations or in populations of the United States, we've selected out the people who are particularly susceptible to rich foods. They're dead. Now, when you start introducing rich foods to new populations of people who haven't been challenged by this particular selective process, you still have a lot of people that can get it. I mean, the people from India, for example, the continent of India, they're just newly exposed to the rich Western diet. And over the last 40 years, we've gone from a situation where the upper class 40 years ago were the only sick people, the fat ones with diabetes and heart disease and kidney disease and so on, to where starting about 20 years ago, we included the middle class. And now it's only the lower class in India that doesn't have epidemics of these diseases of kings and queens. So we've seen this right in front of you. It's happening. Same thing in Asia. In Asia, for example, China, we have real good data on. Before 1980, there was no type 2 diabetes. All right. Before 1980, 90% of the diet was white rice. In 2013, we have data. Well, we have even newer data than that in China, but I can recall the paper written in 2013. Currently, the Asian population, about 12 to 14% has diabetes, wow, including China, and half of them are pre-diabetic. Now, what's happened in the last 40 years between 1980 and 2022? What's happened? The Asian has become wealthy. They've learned about the best way to eat from Europeans and Americans. They've learned the rich diet, and they've taken it on with enthusiasm. It's right before your eyes. You've seen it. Come on, ladies and gentlemen. Just open your eyes and look at what's happened. Every population, India, Asian populations, South America, it's happened, Central America, every population that has given up a starch-based diet and instead eaten a diet centered around animal foods, meats, dairy, etc. They've all gotten fat and sick. You've seen it. Your grandma and grandpa likely are still healthy, living on their favorite foods. And the kids and the grandkids right before your eyes are getting fat and sick. Anyway, once you know this, once you understand the cause of illnesses, and I'm talking to you about maybe 90% of the problems people have in the Western countries. Then what you can do is you can introduce something real simple, and that is when you stop what's causing the disease, the body has a chance to heal.
Right.
And so, you stop throwing gasoline on a fire. And what happens is the healing capacity of the body is tremendous. If you've ever seen somebody in a horrible automobile accident and all mashed up and everything, it heals. And it's the same thing with diseases due to diet. Once you remove the things that are causing the damage, and you give them some basic food that allows the metabolism to work at its best, that people heal. In other words, simply stated, is the healing capacity of the body now outstrips the damage that's being done. And you can see cure, progress, improvement. But as it is now, the damage is so intense, is so frequent. I'd say it's 3 or 4 meals a day, that the healing properties of the body can't catch up. And as a result, people have, closure of their arteries, their kidneys are shutting down, they're developing diabetes because their metabolism is all screwed up. Anyway, that's basically it. And it's something that once people learn, and they can justify themselves, either because they're scientists or because they've just opened their eyes, then they can take action. And so instead of having bacon and eggs for breakfast, you have oatmeal. Instead of having for lunch and dinner, pork chops and, fried chicken and et cetera, the routine. You have bean burritos or mushu vegetables and rice or pasta and marinara sauce, and you heal. I mean, our published data shows that in 7 days, we can get nearly 90% of people to reduce or stop their medications. Medications used to treat diseases of wealthy.
So sorry, that was in 7 days. In 7 days, what percentage of patients can you get to reduce medications? Or
90%.
90%.
Okay, our data show, it's published data. You can look at the research. Look up my name on in the National Library, and you'll see 90% of people in 7 days.
Is this medication generally, or are we talking specific for?
Well, it's medications used to cover up the symptoms and signs of dietary diseases. Like, for example, high blood pressure, that's from the food. Diabetes is from the food. So, we have very specific data on taking people off blood pressure pills and pills for diabetes, medicines for diabetes. But in general, I mean, you don't take off...
and just to be clear, John, that's done in a medically controlled environment.
Yeah, it is. We have doctors who supervise it, and that's probably part of the problem. It's not that it's difficult to stop medications. You really don't. Except for legal issues, you don't have to have a medical degree to stop this garbage. If you look at the data, what you see is that there's no improvement in survival, no reduction in heart attacks, no reduction in strokes from all of our aggressive treatment. In fact, aggressive treatment kills. You look at the diabetic research that's done. There have been 6 major studies. One was done in Europe. It was the TRACE study. And the other 5 were done in the United States. The 2 veteran studies, the ACCORD, the ADVANCE, the DCCT study, which was also done in Britain. They all show that aggressive treatment of diabetes, type 2 diabetes, increases the risk of dying, increases the risk of heart attacks. In fact, the National Heart and Lung and Blood Institute in our country stopped the ACCORD study 17 months early because it was killing people. So anyway, you take the fact that we know what causes the diseases. We know the bandages, the patch jobs, the treatment of the signs doesn't work. And the more aggressive you get, the more harm you do to people. Then you're left with the only logical approach, which is get rid of the problem. And you get rid of the problem by eating a starch-based diet.
Okay.
This shouldn't be hard to see.
I want to focus in on a few of the subject areas that we're concerned with, or we're tasked with looking at, let's say. So with regards to diabetes, I pulled a lot of this information, just a little quick information from probably the NHS website, principally the National Health Service here in the UK. It says diabetes is a lifelong condition that causes a person's blood sugar level to become too high. So it says that it's a lifelong condition and that there are 2 main types of diabetes. Type 1 diabetes, where the body's immune system attacks and destroys the cells that produce insulin. I think we won't focus on that today. We're going to focus on the more common type 2 diabetes, where the body doesn't produce, it says here, where the body does not produce enough insulin or the body's cells do not react to insulin. Type 2 diabetes is far more common than type 1. In the UK, around 90% of all adults with diabetes have type 2. That's the one we're focusing on today. As type 2 diabetes is a progressive condition, medicine may eventually be required, usually in the form of tablets. So first of all, do you agree with that definition?
Yeah, I agree with all of it. You're just looking at it from the wrong point of view.
Right.
Okay, type 1 diabetes is an autoimmune disease. It's where the body attacks itself. You should be asking, why does the body attack itself? Well, this autoimmune disease is caused by the food. I've written extensively on it. Once the pancreas is destroyed, it does not grow back. So a type 1 diabetic must stay on insulin the rest of their lives. Type 2 diabetes and a type 2 diabetic, as you just told me, they have plenty of insulin. It's just the insulin doesn't work. They will have as much insulin as somebody without diabetes. In fact, sometimes they'll have twice as much insulin in their body as somebody without diabetes, but the insulin doesn't work. Why does it not work? It's because of insulin resistance. You just told me that. Why do you develop insulin resistance? It's because you're getting too fat. The body, see, insulin drives fat into fat cells. All right? So you get so big, say you gain 30, 40 pounds, the body says, enough, I've had it. And it creates insulin resistance, which happens at the cellular level and also with the insulin molecule itself. And so the insulin doesn't work so good. So the blood sugar goes up. But what you've done is you've halted the massive accumulation of body fat. Once you lose the weight, it's cured. How do I know this? Well, what you can relate to is what standard medicine talks about. When you do bariatric surgery, you know what I mean by bariatric surgery? It's rearranging the intestinal tract so people lose weight, right?
I thought it was. I thought that was like the kind of reducing of the size of the stomach.
Well, that's one form. There are sleeves, there are bypasses, there are all kinds of bariatric surgery.
Okay.
The cure rate or dramatic improvement of rate is over 80% of people who go through this surgery who have type 2 diabetes, it goes away. So by any way that you lose weight, it goes away. Why? Because it started. Its reason for existence is to stop the massive accumulation of body fat. You get 100, 200, 500 pounds overweight, you're in big trouble.
Yeah,
so it stops at a 30, 40, 50 pounds. And the way it does is by making the insulin less effective. It's called insulin resistance. You told me this. That's why it happens. So like I say, all you have to do is get them to lose weight and it goes away. You can put them on the Atkins diet. You can starve them. You can wire their teeth together. You can do bariatric surgery. You can lock them in a prison cell. I don't care what you do. They lose weight and it goes away.
Aren't there also slim people? Aren't there also slim people who are diabetic, type 2 diabetic?
Well, they have something called either type 1, okay, where the pancreas is totally destroyed, or they have something that I refer to, and your doctors do also, as type 1.5 diabetes.
Okay.
Okay. In this case, you have partial pancreatic insufficiency. In other words, some of the pancreatic cells have been destroyed, but not all of them. You still produce enough insulin to keep you out of the hospital, but you don't produce enough insulin to keep the body fat on. Remember, insulin drives fat into fat cells. So if you become partially insufficient, which is what type 1.5 is, you end up losing a lot of weight. In fact, the classic thing that happens in type 1 diabetes is weight loss, profound weight loss. Well, you have a condition between type 2 where you make as much and sometimes twice as much insulin as somebody without diabetes, and type 1 where you make no insulin. The spectrum in between is what you're talking about. Type 1.5, that's what it is. And it has to be treated, well, the way I treat them is I, of course, put them on a good diet and get their insulin working as efficiently as possible. And then if they're losing too much weight, I give them a little bit of long-acting insulin. It's called Lantus. And that stops the weight loss.
Okay.
Next.
I guess the points that I was saying and whether you agreed with the statement or not was.
I agree with everything. Everything you say, I agree with.
So you agree with as type 2 diabetes is a progressive condition.
Yeah, because you keep shoveling garbage in your mouth. What do you expect it to do?
So what you're saying, it's not progressive, however, if the diet was to change, that it's not a given that it's going to progress.
It's progressive and incurable if you believe the diet you're eating in England is the normal diet for human beings.
Right.
But once you stop that diet, then you are cured of the problem.
Okay.
Especially associated with weight loss.
And another point.
Not type 1.
Not type 1, of course, no. And the other point that's made here is that diabetes, it starts with diabetes, is a lifelong condition. I mean,
tell me how many people change their diet? Come on now.
Right. So, I mean, you're saying that are you saying, I mean, just to confirm, then you're saying diabetes type 2 is easily manageable, controllable, and
100%
reversible, curable.
100%. Absolutely. And you get any expert to come on this show and tell you otherwise, and I'd be glad to show up with them. A type 2 diabetes, I mean, pure type 2, is 100% curable with weight loss by any means. But the best way to lose weight is to fix the problem, which is the wrong food. When you go from animal foods and oils, which are the 2 dietary poisons, animal foods of many different kinds, secretions, body parts of animals, etc., and oil, free oils like corn oil, safflower oil. When you stop eating those things, and that's the primary source of calories in the European diet and the American diet, when you stop eating them and you start a starch-based diet, which has been the diet of 99.9999% of people who ever walked this earth. I just told you that.
Yeah.
All
okay.
Right.
I mean, so
good question. You're being told half the truth.
So diabetes affects such large numbers of, I mean, why do you think it, I mean, you said it's really the food basically that comes down to it. I mean, here we've got some statistics that anyone from an African, Caribbean, South Asian background, again, this is taken from the NHS guidelines, is significantly more at risk of developing diabetes. Also saying that South Asians are at risk of developing diabetes from age 25, whereas it's 40 for other groups.
Well, I explained that to you, but I'll do it again.
So, I mean, okay. So you think it's the genetic, there may be we've not weeded out the weak actors from South Asia.
We've not killed all the weak ones yet. See, these people you mentioned, the Asians, people from the continent of India, they've only been exposed to the Western diet in mass in the last 50 years. Right. So you've got all these people who have been living healthy on starch-based diets. And all of a sudden they're exposed to European eating, American eating, aristocrat eating. And what happens is they get sick. What do you expect?
Okay.
And that's why you say, okay, us white guys who live in here in Europe, we're somehow immune to it. But the people of color, they're weak. They got diabetes and more heart disease and, excuse me, this is bigotry.
Interesting. I mean, on the flip side, you've treated many people with diet. Do you see people of Asian or African descent who adopt the protocol? Do you see them recover at a quicker pace? Is that something observable, or is it the same?
People are people. You say otherwise, it's called bigotry. The blacks and the browns and the yellows and the whites, they all get sick from eating the Western diet, and they all get well when you stop it.
Right. So I guess the point you're making is it's the food. It's
the food. You look over our website and you'll see that stated 100 times. Okay. It's the food. It's you fix the food. Well, how in the world would you expect otherwise? Say for example, many of you have kitty cats as pets. Okay. Say for example, you decided that you're not only going to feed your kitty cat the diet your kitty cat should eat. Instead of feeding it meat, you feed it baked potatoes. Okay, what would happen to this cat? I don't care. Maybe there's some genetic propensity towards it in the cat population, but I think pretty much all of them would get sick, lose weight, and die. Don't you?
Right.
Because it's not their food. Now, you could introduce all kinds of, you could give them a bunch of pills to correct some of the signs of the fact that this kitty is suffering from malnutrition. You could exercise this kitty cat. Right. Okay, take him for a walk around the block 2 or 3 times. You could give this kitty cat psychological comfort by rubbing his belly and his ears several times a day. But you're not going to get the kitty cat well until you put the kitty cat back on the kitty cat's diet. It's just that stupid simple. So it's the same thing with you feed the wrong food to the wrong species of animal and they get sick.
Right. And in principle,
we're eating a diet of kitty cats. We're eating a diet that you would get arrested for feeding your dog and cat. if in the United States, if you fed your dog and cat cakes and pies and ice cream cones and candy bars, we have something called the Humane Society that would arrest you. But you can turn around and feed your children cat food or calf food, and the kids are sick and dying, and nobody's taking any effort to fix the problem.
Okay, I mean, I'd say a few things.
Like I said, I read this article this morning in the paper about how children are getting surgery for obesity. My God, when are we going to start standing up and fixing this problem?
It is a big problem. I mean, with regards to what you're saying there, a lot of the listeners will think, my grandfather, for instance, ate animal products every day, chicken livers, hearts, whatever, and lived till the grand old age of 95 or 100.
And he smoked 2 packs of cigarettes a day. Yes,
not sure about that. Maybe they did potentially. It's true. Like, so, that's one side of things. But also, I know medical doctors that
let me point out, we only talk about the survivors. By the way, we don't talk about the other grandpas that died of heart disease and strokes from this behavior. It's only the survivors we talk about. It's like the person who smoked cigarettes for 2 packs a day for 40 years. We talk about them, particularly for a smoker.
Right. So what you're saying that these are the people that won the genetic lottery. It's not
whatever
defines
which brings me to a point, and that is if smoking a cigarette causes you to end up on a respirator the next day, you'd never smoke.
Right.
If drinking a shot of whiskey caused you to fall down and break your bones, you'd never drink every time. Okay, if eating fried chicken, fried fish, French fries, all that garbage causes you to have sudden death, at least within a week or a month, you wouldn't do it. But these are long-time diseases. You have to abuse yourself for decades before the mass of the population shows the illnesses.
And so why?
Of course, because we live.
Why would most medical doctors today that I've come across, or I mean, some of even the more celebrated personalities in medicine in the UK, when it comes to weight loss, rather than proposing a starch-based diet, will generally tend towards a ketogenic diet, which is, and apparently in the studies, a ketogenic diet is the diet that promotes the greatest weight loss in the shortest period of time. So, I mean, what would you say to a doctor who agrees with you? Would say it's about weight loss, but would be like, we should propose a ketogenic diet.
I could have included a keto diet. A keto diet cures diabetes type 2. All right. But you also end up with a dramatic increase in risk of heart disease, an increase in cancer, constipated, bad breath. I mean, there are better ways to lose weight than the keto diet. Why do people in your country support it? And I've run across some of these people. I don't know. Maybe they work for the meat industry. Maybe they work for the dairy industry. Maybe, and some of the people that are promoting all the drugs and all the procedures, maybe they work for those industries too. And maybe they can't see across their own dinner plate. That's a problem. The scientific community is confused. They got a medical journal in one hand, which says eating these high saturated fat, high cholesterol foods will kill you, will give you a heart attack. With the other hand, they're shoveling bacon and eggs in their mouth. They're confused because of their own personal habits. But again, if you look at, I gave you some broad sweeps and understanding. You get your ketogenic people to explain why 99.999% of people who walk this earth have lived on starch-based diets. You get them to explain why recently, all of the marathon and triathlon winners have been from Ethiopia and Kenya, which eat a diet of 80% corn. Why are the low keto guys, the keto guys, not at the front of the pack winning the marathons and triathlons? There's so much obvious stuff in front of you which make you question this nonsense. The meat, the dairy industry are powerful. The medical business, they are the downstream of all this sickness. The sicker people are, the more drugs you sell, the more hospitals you open up, the more doctors that are paid. The downstream of this much illness is a hell of a lot of profit for a lot of people. And excuse me, last time I looked, human beings were driven by money, unless that's changed.
It's interesting what you say there. I mean, at the same time, I'd potentially argue that some of the doctors that I've heard reflect upon like a ketogenic diet as a solution rather than a low fat or a plant-based diet, like the type of which you would recommend, don't seem to have that in their head as a way that they profit from it in any which way or form. It's simply they understand that to be the correct diet for them.
They're looking at it from a very narrow point of view. From what I see, the ketogenic diet causes you to lose weight, and rapidly, and so people are happy about it. The first phase of the keto diet, the first week or two, you lose water. Okay, there's stored in your body carbohydrate. The body prefers to burn carbohydrate. So as soon as you stop eating carbohydrate, it relies on these stores called glycogen stores. So you lose 6, 8, 10 pounds of glycogen and water the first week. Okay, you're really excited. And then you go into ketosis. You've mentioned a keto diet. Do you know what ketosis means?
From what I understand, it's fasting mimicking, right? Or ketosis means you begin to release the ketones, don't you? Like fat for energy, essentially.
Let me explain to you what ketosis is. When you don't have carbohydrate around, the body has to resort to fat metabolism. So it burns fat, and one of the byproducts of fat metabolism is ketones. Ketones suppress the appetite. There are two circumstances that occur naturally where people go into ketosis for a survival benefit. One is when they are starving to death. Okay, it takes about 60 days to starve to death. The first 3 days, you're dominated by the pain of hunger. You need to get out of trouble. So the body goes into ketosis to kind of free your mind. So you're not always thinking about food, so you can think about getting yourself out of trouble. So it occurs when you starve to death. The other time ketosis occurs is when you become ill, seriously ill, chronically ill. You go into ketosis because when you're ill, you're supposed to be recuperating. You're not supposed to be gathering and preparing food. So what the keto diets do is they simulate sickness. This is why I call them the make yourself sick diets, because that's the way they work. I can get the same results by giving people cancer chemotherapy. They will lose weight. Their blood pressure will come down. Their cholesterol will come down. They'll lose their hair and they'll throw up for a year. But I can get the same results with cancer chemotherapy. What doctor would brag about prescribing cancer chemotherapy for weight loss? This is a make yourself sick diet. That's how it works. Now, that's the short term. The long term, and you've heard it, eating these foods gives you heart disease, strokes, cancer, constipation, bad breath. Excuse me. There's a better way to lose weight than to make yourself sick. But like I say, there's a lot of vested interest. People can't see beyond their own dinner plate. They work directly or indirectly for one company or another that financially benefits from a whole bunch of sick people.
Okay.
Now, whether or not they directly think about that, I'm not claiming. I'm not saying consciously are they evil people. I'm just saying they're doing the wrong thing.
Yeah. Well, I mean, I could say
you called it a keto diet. Now, I want you to learn and think about what keto means. Study it. It occurs as a mechanism when you become ill. It's a survival mechanism. these are make yourself sick diets.
Okay.
And besides that, look, there are a couple other things about these diets. They feed the very foods that people have become to prefer, all right, because, well, a whole bunch of reasons. And they're also easy. The learning curve is almost nothing. What you do is you drive through the fast food restaurant, you take off the bun, you scrape off the mustard and the pickle and the ketchup, and you're on the keto diet.
Okay, so got you there then. So the problem with the diet, well, just to kind of reiterate what you're saying there, weight loss will resolve diabetes. You can do weight loss in many different ways. Probably the best way to, one of the most effective diets to do it that's been studied is the ketogenic diet. You're accepting
that's not true.
However,
that's not true.
Oh, sorry. Well, let me. However,
it's not the most effective diet studied.
Okay.
The truth of the matter is they've not studied the most effective diet. When these studies are put together that you're referring to, they really do not teach a low-fat diet. They teach a diet that's 30 to 40% fat. It's basically rigged from the beginning. Now, I want to ask you a question. You rely so much about the printed word and science. If you think about Asians, traditional Asians, do you think about fat or thin people?
I mean, I'm Punjabi, so
I'm asking you a question. When you think about Asian people, do you think about fat or thin people?
Well, like you say, when I think of Indians anyway, when I think of regular Indians, like the man on the street, with the market stall or what have you, they're all slim. If I think of middle class,
what is their diet? What is the diet of the Indian?
I don't
know rich, but the common man, what's the diet?
That would presume a lot of rice and lentils and bread.
Okay. Now let's do the Asian. Okay, let's do the Asian. You admit that the Asian, we're talking about 2 billion Asians. They're trim, no obesity at all until they switch to the Western diet. What do they live on? What's their food?
Yeah, the principal diet is rice. Like a lot of carbohydrates.
Okay, well, why are you telling me the best study, the most effective way to lose weight is to eat a keto diet? I just told you.
I'm repeating what I've read. I'm a simple man, let's say, Dr. McDougall. But right. I mean, I've read that. I've read that, and I found it interesting. But you're saying that it's true that the ketogenic diet is effective at weight loss. However, it comes with a number of problems, which include bad breath, smelling bad generally, constipation,
cancer,
heart disease. So there's a lot of other effects that haven't been
and plus your food bill is 3 to 4 times as high.
Right.
Rice is cheap. Potatoes are cheap. Why do you think that meat is preferred? Like I say, you need to look at the whole picture. You need to look at the patient. You need to look at people. You don't need to look at rigged studies.
Okay.
And again, I'm a scientist. Okay, I'm a medical doctor. I've been at this for more than 50 years. I can figure out the trickery that goes on in a study. They don't fool me. I know what they're doing, and the popular press buys into it. But as you're buying into this nonsense of keto diets, think about it. Who are the trim people around the world, and what do they eat? Okay. And what happens when they give up their starch?
Okay.
Think about it.
So if you're listening out there, beware of the keto diet and be aware that there's other diets that achieve the same goal of weight loss, but come with far less baggage and far more benefit.
All right, listen.
At the same time.
But the difference is the sustainability. People don't stay on the keto diets. I would give Robert Atkins as he's the leader of keto diets in the United States. Robert Atkins was about 60 pounds overweight when he died. He suffered from heart disease. You can't stick with the diet because it makes you sick. How long can you be sick? The other approach you can take is you can starve yourself to death, or partially. They're called dieters. Portion control.
For the
then you're in pain all the time.
For the listeners out there who aren't exactly aware of what the keto diet is, the keto diet basically involves a consumption of a large amount of fat, protein, and virtually none to very little amount of carbohydrates. And I've seen that
let's
actually.
talk about it.
I'm sorry?
Tell them what those foods are. Don't talk in that kind of language.
Okay, so
it's to consume a large amount of meat, poultry, fish, grease, butter, brie, and less carbohydrate, potatoes, rice, corn. Use the words that people understand. They can see rice and corn on their plate. You know, they can't see saturated fat and cholesterol on their plate. Let's talk in language that the common person can understand. When you eat the meat and the dairy and you get sick.
And I guess what
populations, you cannot give me an exception. You can't give me an exception of a population that violates what I just told you. People, billions of people who live on starch-based diets are trim. They have no breast cancer. They have no colon cancer. They have no prostate cancer. They have no rheumatoid arthritis. They are hardworking, strong people. I mean, consider the fact that the United States almost lost World War II to starch eaters. Consider the fact that the United States lost the Vietnamese conflict to starch eaters.
What do you mean they almost lost World War II to starch eaters? Who were the starch eaters?
Well, who do we almost lose World War II to?
Well, Germany.
It's called Japan.
Japan. Okay. All right. Okay.
Japan. Remember Japan?
I'm sure the Germans were.
And what are the Japanese? Let's carry this further. What do the Japanese live on? What's their food?
Well, yeah, a large amount of rice, isn't it? You know, I mean, some people might say fish.
How much rice? How much rice is a large amount?
A lot.
I mean, like 90% of the food is rice. Okay. Right. Come on, let's not mince words. This is a really good discussion. Let's get some common practical things out here.
I mean, also it is worth saying. I mean, in my country of India, there are a large number of vegetarians. You know, make up maybe 30-40% of the population. But if you go across, the rest of Asia, you know, Thailand, China, Japan, as you say, most people wouldn't describe themselves as vegetarians, right? So,
but this is not. Did you hear me use the word vegetarian once so far? I've talked to you about starch eaters. I haven't said vegetarian. You're talking about a religion. You're talking about ethical things.
Yeah.
I'm talking about the food that should be on the plate. It's starch, not animal foods, not free oils.
Yeah.
Let's not throw in terminology that upsets the whole public. Oh my goodness, I could become a vegetarian.
No, what I mean
you're not a vegetarian.
What I mean by that
is you're not a vegetarian. You are a starch eater.
Yeah. I was going to say what I mean by that is we commonly kind of understand the Japanese to be a very healthy population, and they aren't.
No heart disease. No heart disease. After World War II, they had virtually no breast cancer. The number of cases of prostate cancer reported after World War II in Japan was 73. Okay. Anyway, you get it. I know you get it. I know we haven't talked this long for you to fail to get it.
Okay. All right. So, you know, we've spoken then about diabetes. I mean, just before we skip to the next subject, and we've kind of covered, I think we've kind of covered your ideas on the other areas in what we've been discussing here so far. I feel like I'm going to get a repeat answer and a bit of a telling off if I venture down there. But just before we move from diabetes, are there any particularly good foods for diabetes that would be recommended that could act almost medicinally, or are there any particularly bad foods that should be avoided? I think we've identified them, but I'll ask you anyway.
Ditto. Yeah, if you feed a diabetic starch, then they end up looking like starch eaters. What do starch eaters look like? They're trim, right? Look, this is a very simple lesson, ladies and gentlemen. The foods that are medicinal are the ones that run the machinery properly. The human body has a diet. The diet of the human being is a starch-based diet. The diet of your kitty cat is meat. Okay? The diet of your parrot is vegetables and nuts. You know, each animal has a diet. We are being raised, we're being fed from almost childbirth on. We're feeding a diet that was never intended for human beings, in a diet that you wouldn't even feed to your pets because they'd get sick.
So, Dr. McDougall, if you fed a diabetic, a starch-based diet, as you would suggest,
I've done that with hundreds of them.
rice,
Hundreds.
rice, potatoes, bread.
Yeah.
I mean, these are some of the most, high glycemic foods, highest glycemic foods available. I mean, how?
Don't, let's not get into the glycemic index stuff because I'm going to run away with you on that one. But go
Okay.
ahead.
Wouldn't suddenly moving from someone from a whatever diet they were consuming to, and they're diabetic, to a starch-based diet of potatoes, rice, beans, bread, wouldn't that raise their blood sugars?
Well, I don't know. Maybe they should eat Snickers bars. Snickers bar, a candy bar has a glycemic index of 67. Rice has a glycemic index of 110. Maybe we should feed them Snickers bars. Glycemic index is just one quality of the food, okay? There are so many other qualities of food that are important. Some of the lowest glycemic index, animal foods are real low in glycemic index. They produce no elevation in blood sugar. Then we talked about enough about animal foods are the wrong foods for people. Anyway, the glycemic index is, you're getting into an area that unfortunately we shouldn't get into, because you make no points that are in favor of eating an animal food-based diet.
I just worry for the listener out there who has diabetes, who's frustrated with not being able to overcome.
100% of type 2 diabetics are cured by weight loss. The most effective long-term way to lose weight is to eat a starch-based diet.
Okay. But are we saying that somebody who would move from a non-curing diet to a starch-based diet, would it be that for a little while maybe they would witness elevated blood sugar levels, and they should feel
for a couple of days, sure.
For a couple of days, right?
It would go up. After all, what are you trying to treat? Are you trying to treat blood sugar numbers? I can give you pills to do that.
Right.
I can give you insulin to do that. Are you trying to cure the person of the disease? But look, type 2 diabetes, I've taken care of hundreds of them. And the scientific literature is absolutely clear that what I do is correct. And that is, when you take somebody from fats and oils to sugar, even white sugar, insulin works better. Okay? We're beating this one to death. I think what you're getting to is, you don't want all the diabetics out there in your native land to decide they're going to stop all their diabetic pills and all their insulin. If they're under my care, if they're type 2 diabetics, they would. If they were my patient, they would. Because I stop insulin doses, over 100 units a day. I stop them immediately when I switch people to a starch-based diet, if I know they're a type 2 diabetic. Every one of your diabetic doctors in your great land knows that type 2 diabetics are not insulin dependent. They don't require insulin. Every one of them, they'll tell you that. Well, why are you giving the insulin? Well, we'll make the blood sugar normal. But when you make the blood sugar normal, you drive fat into the fat cells, so you make the patient fatter. And being fat causes diabetes. So you're on this vicious cycle. So nobody gets well. In fact, they just get sicker. The more they get treated, the sicker they get.
Okay. All right. Good. So, and any particularly good foods for diabetes?
Are you sorry you did it? Are you sorry you did this interview already?
No, at all. I'm very, very happy, in fact, and I think there's going to be some very useful information here for our listeners. I just want
I just want people to understand the big picture.
Yeah.
There's nothing wrong with you. You are not a genetic mishap. Okay. The problem is the food. If you fix the food, then most of the problems you're having will go away. The bowels will start working. The indigestion goes away. You lose the excess body fat. The blood cholesterol comes down. You end up being more like a marathon and triathlon runner than a loser. Because after all, as we just said, all these long races are run by people who eat a diet of 80% corn.
Okay. And is there any specific foods that you would say a diabetic should veer towards?
No, there's no, our cure rate with type 2 diabetes is as good with rice as it is with potatoes.
Right. Okay. So it's the entirety of the diet that makes the difference. And
again, let's go back to where we started this conversation. It's only been the last 100 to 150 years that people have been eating en masse like kings and queens. Prior to 150 years ago, prior to the Industrial Revolution and the harnessing of fossil fuels, most people lived on the planet, say 2 billion of them, could not afford to eat like kings and queens. They lived on what was their food? Oh, come on now. Aztecs and Mayans lived on what? Okay. The Incas in South America lived on what? Okay. Okay. The people in the breadbasket of the world lived on what? The Asian population lived on what? In England, they used to eat barley and oats. It was a couple of the big starches for your part of the world, until the potato came from South America, which, by the way, maybe we should talk about that. What the potato did to the European population.
What did it do?
It eliminated hunger. It eliminated hunger. Prior to that, there was massive starvation in Western Europe. Anyway, that's a whole nother topic.
Okay. All right. So diabetes done. I think within the diabetes question, we've answered some of the other questions as well. But coronary artery disease, people of South Asian descent, including those from India, Pakistan, Bangladesh, Nepal, Sri Lanka, Bhutan, and the Maldives, have a higher risk of cardiovascular disease, 4-fold higher than the general population. Moreover, they develop heart disease up to a decade earlier, often before the 5th decade of life. South Asians represent approximately 25% of the world's population, yet they account for 60% of the world's heart disease patients. I find that statistic amazing, to be frank. According to the NHS...
Sounds like bigotry to me. It sounds like bigoted thinking. Brown people, black people, come on now, come on. You're calling these genetically weak, somehow
it's how it comes how it comes across to me.
That's what you're telling me. These are inferior people. They are exposed to the He-Man's diet, the Western diet, and they fall apart at a rampant rate. Excuse me, there was no heart disease, no breast cancer, no colon cancer in any of these populations prior to the introduction of the Western diet. Yes, you kill a few off quickly because there's natural selection. We got to get the weak ones out so that you don't have to stop this bigoted talk.
I think you'll be generating a lot of fans amongst the listeners right now by saying that. So, and you're
I'm not here to win a popularity contest.
I feel that that's right. I feel that that's right. But
I've tried to do? You know what I've tried to do? I've not tried to get you to believe me. I've tried to get you to open your eyes. All right. There are a lot of very articulate people out there giving different messages. I just want you to open your eyes and look. It's right in front of you, the problem, and so is the solution. The problem's the money. It's the money. You ever heard that before?
Follow the money.
Follow the money.
I wish somebody would do that from the legal system so that we could, bring them to court. So, coronary artery disease, according to the NHS, coronary heart disease cannot be cured, but treatment can help manage the symptoms and reduce the chances of problems such as heart attacks. So, heart disease cannot be cured, but treatment can help manage the symptoms, and reduce the chances of problems such as heart attacks. Do you agree with that statement?
It's not true. That's not true, but let's expand that conversation. The treatments can make the problem less. Well, how did you say that? The treatment can make the problem more pain-free or livable?
Can help manage the symptoms.
Manage the symptoms. Did you say anything about keeping people alive longer?
It doesn't say anything about it. It says reduce the chances of problems such as heart attacks.
Let me explain something to you. Okay, let me explain something to you that's really important. Let's talk about open heart surgery, or let's talk about all heart surgeries. There are 3 studies that have been done on coronary artery bypass surgery. They're the CAS, the Veterans, and the European study. Okay, there are no more studies, just 3. None of them show a survival advantage from doing open heart surgery. There have been about 15 studies done on angioplasty. Okay, this is where they put stents in. All studies show that doing this procedure does not reduce the risk of dying. Okay, so it may help with symptoms, but it doesn't reduce the risk of dying. Your first part of your statement is incorrect also. It's curable, and we've shown that. You know, some of my contemporaries, like Dr. Dean Ornish, has shown reversal of this disease. Dr. Caldwell Esselstyn. You know, if you don't want to accept it, I understand. The heart surgery business is it's $100 billion a year business, which had been proved not to save lives. Why don't you look? If these things don't work, and they don't work, why not try something as simple as potatoes or rice or corn?
So what you're saying is that doctors, if I heard you right, Caldwell Esselstyn and Dean Ornish have already shown that heart disease can be reversed or cured. So then the question is, why isn't that the standard of treatment approach? And you're saying that that's because of the money that's vested in the current approaches to treat heart disease.
I think you got it.
Right. That's a pretty dark picture of the world, isn't it, Dr. McDougall?
Well, have you learned differently from the way people act? Have you? I mean, is there any lesson in history that teaches you differently? I mean, there have been a few individuals who have taken an exception to this, like Jesus Christ. But besides that, I mean, pretty much, don't you think it's pretty normal human behavior to let people suffer for money?
Okay, and you're saying that the kind of the treatments that we have, you know, that we have available to us through accessing, you know, the hospitals and the doctors within them, such as angioplasty, do nothing to increase life expectancy.
That's correct.
They may treat the narrowing of the arteries, but not treat actual life expectancy, improve life expectancy.
That's what all the studies show.
Okay.
Look, I know this research very well, and I challenge any of your experts to show me differently. Also, if you want to talk about statins, you know, statins were all the rage 15, 20 years ago. These are the drugs that lower cholesterol, but not so much anymore. You know, the major consensus paper, the major opinion papers are that we've overblown the benefit of statins. Whereas we come from a time when doctors used to say we should put statins in the drinking water, like we do fluoride, because heart disease is so common. Now what we're teaching, what we understand, what your doctors understand, is that statins make very little difference and only help in a very small way people who are really sick, and they should not be turned loose on the general population. I mean, this is science. It's solid science. You're going to find nobody who says differently. Bring another guest on the show and take point by point of what I said and tell them to say otherwise, or bring me back on the show with one of your experts.
As I say, I'd love to do that. I would love to have that panel discussion.
Hey, listen, I volunteer. Just make sure that that we have a civil conversation.
Yeah. Yeah,
and we keep it to the science.
I'll try my best. So again, then what we're saying with heart disease, I mean, what I've heard you saying then is a little bit troubling in terms of that it is reversible, but it's probably not reversible within the hospital system that we have currently. And then also within the hospital system, the doctors that you're likely to be meeting will be recommending treatments that won't extend life, even if they might treat the issue of a narrow heart artery, for instance. They won't necessarily extend your life any further.
You know, when you end up in the hospital, particularly when you have major surgery, this is a teaching moment. You're laying there, you just had your chest cut open, and you look at your doctor, you say to your doctor, I need cardboard to not be in this situation again. And the doctor says to you, hey, you need to eat that cheeseburger. You just had surgery. You need all that protein. The hospital system deserves a kickback from the pharmacy and the surgical departments of every hospital. Need a kickback from the food service, because you propagate in your hospitals the continuation of the diseases. The very foods that cause people to be sick, when they go to the hospital, they get served these same foods. And here you have this wonderful teaching moment. I don't get it. Yeah, I really don't get it. I've been, like I said, I've been at this I've been doing diet therapy for 46 years, written 13 national best-selling books on it, taking care of over 12,000 people. And, I consider myself the luckiest doctor in the world because my patients get well. They don't get a bunch of excuses and a bunch of pills and sent off to surgeries that can most of the time be ineffective. Let's be clear here before you jump over the rail here and accuse me of completely condemning medicine. There are some wonderful things we do in medicine, all right? I mean, penicillin is a phenomenal medication, but not all medications are phenomenal. You get in a car accident and you're bleeding to death, surgery is a wonderful thing. But surgery can't be unleashed on all problems. You should avoid the car accident. That's what you should do. Anyway, there are some bright spots in medicine, especially when it comes to acute illnesses. You know what I mean by acute illnesses, like infections and lacerations and broken bones. Those we have some wonderful therapies for. But when it comes to chronic illnesses, I mean, chronic means it never gets better. When it comes to chronic illnesses, we fail, or we wouldn't call them chronic. Obesity, cancer, diabetes, kidney disease, heart disease, these are chronic illnesses. We speak of them in no other terms because they never get better. Why do they never get better? Because everything in our society supports the continuation of the diet that damages the body. An animal food-based, oil-based diet. Something that's been just a blip. It's just a blip in human history. Think about it. We've only been eating this way 150 years in mass.
Dr. McDougall, I mean, I'm listening to you, and I feel that you must feel some sense of frustration. You've been doing this for so long. You as you say,
I've given up.
Get better. You've seen so many people get better. In your own through your own treatment, and yet the prevailing attitude out there is that with most chronic conditions, diet doesn't play a significant role, I'll say. Why do you think? I mean, you refer to a system in the US which is very much driven by money and greed, and that might be driving a number of the issues over there. But over here in the UK, we have the National Health Service, a public sector-driven organization. The idea is that we have doctors within that who are driven by, principles of service rather than principles of profit. Why do you think then they aren't turning to nutrition as a first port of call for treating and managing these diseases?
Well, money is pervasive in all aspects, even if you have a National Health Service. Your doctors were educated in the same medical schools that I was educated in. They're taught the same messages. Your doctors also are subjected to lawsuits by not doing the community standard of practice. In other words, you get sued based upon whether or not you practice like the guy down the street, even if the guy down the street kills you just like you do. So it's because, and I'll tell you why. It's because there's not a reward system for doing the right thing. There have been attempts at the reward system for doing the right thing. You guys are just kind of neutral. You just pay people a salary. You don't reward them for doing the right thing. Doing the right thing was almost done with a program called capitation, and maybe reintroduced back into Western medicine. Capitation is where your providers, your medical doctors, your hospitals, et cetera, get a certain bucket of money, and they get to keep what's left over, but they must deliver care to the patient with this bucket of money. And they get to keep what's left over. Right now, the way they keep more money is they prescribe less expensive medications, or you'd hope so. They have shorter hospitalizations, let's hope so. But they don't deal with the really way to keep the money. And that's to have a group of patients assigned to you who gets well. And then you get to keep all the money. Do you kind of understand what I'm saying? It's called capitation.
Hmm.
So part of the reason that a National Health Service doesn't get a change in the population's diet is because there's no reward for it. You continue to collect your salaries, whether you do a good thing or bad thing. Your medical schools teach the same thing that we teach. Western medicine is dominant, and the drug companies, I have to guess, play a dominant role in England, just like they do in the United States. Do they not? I don't know. Do they give away free drugs in England?
Well, I wouldn't say free. We get them on prescription.
Oh, come on. The drug companies are so interested in your welfare that they're just going to give
compared to the amounts I've heard people pay for medications in the US, you might as well consider it.
Yeah, look, isn't that terrible? Don't you feel sorry for America? Much for the drugs as they cross the border, or in India. Do you see the money? It's. I don't know. I don't have the answer for you. I think you just need a few good people standing up and telling the truth. And I appreciate the opportunity you've given me to tell you what I believe is the truth.
All right. Well, thank you. I mean, Dr. McDougall, we've covered chronic. Well, we didn't get to chronic kidney disease, but we covered a little bit of coronary artery disease and diabetes, and had the desire to kind of touch upon chronic kidney disease and maybe glaucoma and cancer. But I do also get the impression that your answers are going to be somewhat the same, which is that the first way to look at addressing these conditions is a dietary way, and the diet in almost all cases to allow the body to heal is a low-fat, starch-based, plant-based diet. Would I be right in saying that?
You got it.
Yeah,
you got it.
I think that's the first time I've been correct. First time I've been correct on this interview. And
you said a lot of correct things. It's just your viewpoint was narrow.
Okay.
You weren't thinking of the patient. My perspective is I'm a practicing doctor who sits across from my patients and talks to them. You're getting your information from scientists, and most of them work for the drug industry. It's just you have a narrower point of view. You also have a very fatalistic point of view. You're telling me that people never get better. The diseases continue to progress. Well, they never get better because you don't stop the cause. And if people can remember anything from what I said, it's the big picture. Rich foods make people sick wherever you look, anytime in history. And the bulk of the people, 99.99% of people who've lived on this earth, have lived on starch-based diets.
The fat you eat is the fat you wear, kind of thing.
That's another thing. I bet we could talk for another 10 hours.
Dr. McDougall, it's been an absolute privilege and a pleasure to speak with you today. Before we leave, I wonder if you've got any final points to make, some final shots, and also if any of the listeners would like to know a little bit more about what you do and your experiences, how would they be able to find you?
Well, we have a website. In fact, we have a couple websites. One is drmcdougall.com, spelled drmcdougal.com. And I just developed another website. It's from my foundation. We have a 501c3 foundation. And it's about the climate. It's about the effect of diet on our climate, which is a thing I really wish we'd spend a couple of minutes getting into. It's the animal agriculture business that produces most of the global warming gases, more than transportation, more than anything else. And the biggest impact that an individual can make and a population could make on changing the amount of carbon dioxide put into the atmosphere would be to switch from an animal food-based diet to a starch-based diet. Have you ever heard this before?
Yes, I have.
Okay, so it's called McDougallFoundation.org, not com.org. And there's my plea to the world's population to change our diet to save our planet. Why don't we do a whole show on that? The heck with the people problems. My new patient is planet Earth.
Oh, I mean, it's interesting, isn't it? Like we can kind of kill a few birds with. I mean, that's probably a strange analogy to use, but we could probably kill a few birds with one stone by one, adopting a diet that's better for your health and might keep you away from disease, and also apparently it seems that animal agriculture is responsible for a lot of the global warming that we're kind of throwing ourselves towards. So,
do you hesitate in your statement? Do you have any doubt that the animal agricultural business is the biggest polluter?
From my understanding and from what I've read and from what I've understand, I don't have a doubt. But as with almost anything that has value in this world, there are always doubters, and they tend to shout quite loud as well. So the matter is, the concern is really, how do we convince how do the rest of the world act upon the message and kind of reduce their carbon footprint, for the benefit of future generations.
They can do it. They can do it as individuals by changing the same diet that will save themselves. They will cause overnight an 80% reduction in their output of CO2 overnight by changing from the animal food-based diet they're now consuming to a starch-based diet. So that's something you can do as a person.
That's massive.
More important than driving.
Yeah, what you're saying that is, if you don't change your diet, but you were to do as much as you could in terms of, I don't know, reducing your electricity consumption, or the amount that you drive a car or take a plane, or the amount of showers that you have, would still pale in significance to the amount of CO2 you'd save by changing your diet to a more planet.
Well, you got it. And this is the consensus opinion of scientists around the world. All right. So, you are troubled by the fact that the bulk of the opinion out there in the practice of medicine is contrary to what I've told you. All right. People don't want to discuss.
I think people look for a consensus, don't they? They people who aren't experts on a certain area, if they came across somebody who's saying something on, in this case, nutrition, they would look for consensus amongst the experts.
Well, the FAO published a report in 2006 called The Livestock's Long Shadow. And that helped wake up the planet on the fact that the agricultural business is bigger than transportation as far as its cause of destruction of this planet. We've done nothing since 2000. That's been 18 years. We've done nothing. The diet is worse in the face of near extinction. Do you believe otherwise? If you don't believe, we're in huge trouble. I don't know.
I think the problem is, how do we convince? How do the people out there understand and act upon this point? It's been 20 years, I think, plus since Al Gore. Was it Al Gore?
Al Gore did The Inconvenient Truth.
Yeah, I mean, so that kind of put the calling card down that if we don't reduce greenhouse emissions by 2020, we would be falling towards a very unpredictable future. Well, we didn't manage to do that, and we've only managed to increase CO2 emissions significantly since then, largely driven by the increases in animal agriculture. So we are. I don't know how you get people to act. I mean, that was a very celebrated documentary. It kind of woke many people's eyes up to what was going on, and yet we've continued apace in our food production methods and in the release of CO2 into the atmosphere. So I don't know what we do about that myself. It's a frustration for myself, John.
So I'm going to leave you with one very positive message. And I hope that you'll include this in some of your broadcasts, or maybe do a whole show on it. There is a way to save the planet. It's not my business, but I believe it's true. And that's to uncouple CO2 from heat. And it's done by an organization called MEER, MEER.org. And what they're talking about with this organization is using mirrors to reflect the sun's energy to cool the planet, because it's well past time for reduction of CO2. It just is not going to happen. We've got to do it. If we're going to be around for another 1,000 years, we've got to do it to make the planet salvageable again. But immediately we've got to cool the planet. It's called MEER.org, MEER.org. And I think that's, as far as I've seen, the only chance we have.
Interesting.
Have those folks on your radio show. MEER.
.org. Interesting.
Yeah, Yi Tao is the founder of this, and they're at COP27. They are going to be doing presentations at the next presentation.
Okay.
COP27, I believe it is.
Dr. McDougall, it's been a powerful interview. You're a very forthright and clear, I might say, interviewee. Really appreciate the time that you've taken for us today. It's obviously 9 hours behind us where you are over in California, if I'm correct. I feel that the information that you've come with, and which is backed obviously by research and your own clinical experience, I'm hope will be of value to listeners out there, whether that be somebody who's suffering with a disease, whether those be some of the medical doctors that tune into the program, or otherwise. So really, once again, thank you for making the time for us here at Fever FM. Is there any parting message you'd like to leave us with? MEER.org is obviously a thing for us to look at on the climate.
I think that hopefully I get the message across to one person. It was worth my trouble if I just help one person with their problems. But as far as changing the world, I thought I was going to do that 50 years ago when I discovered this. It's not happened. People are not lining up at my door to hear what I have to say. But I can't change that. I can just tell what I believe to be the truth, and appreciate opportunities like you've given me today.
It's been an absolute pleasure. Thank you very much for joining us today at Fever FM. That was Dr. John McDougall.